What is the best approach to put Medicare on a permanently secure financial footing?
Putting Medicare on a firm financial footing is going to, first of all, involve repealing Obamacare. Look, let's take a look at what Obamacare does to Medicare. First thing it does is it cuts $700 billion out of Medicare. It's pretty hard to say you're in favor of Medicare and cut $700 billion out of it. But let's take a look at the second thing it does, which is even worse. It creates a 15-person IPAB board that will effectively be the people deciding who gets medical treatment and who doesn't. This is rationing. This is government rationing.
The Affordable Health Care Act, known as Obamacare, does not cut one dime in Medicare benefits. Not one dime. It realizes savings by taking some of the big profits away from the insurance companies, the corporate welfare that they were making off Medicare Advantage. It lowers some of the reimbursements to hospitals because it depends on the fact we're going to have more paying customers. But it doesn't cut a dime of Medicare benefits. And by the way, once again, it's the same $700 billion that he voted for in the Ryan plan a couple of times. It closes the donut hole, and it extends the solvency of Medicare for 8 years. Now, what I didn't hear in Congressman Akin's answer was his plan. His plan is to privatize Medicare. He wants to give seniors a voucher, and once you spend your voucher, you're on your own.
The idea is that the senior has a choice in medicine. That's the idea. Instead of having one size fits all, which is the big government solution. We're trying to allow choices. Look, there's one thing in medicine that I don't like, and that's when an insurance company gets between the doctor and the patient. But there's one thing worse, and that's when the federal government gets between the doctor and the patient. And I don't support, and neither did 71% of the Missouri public support, the bright idea of having the efficiency of the federal government and the compassion of the IRS running our health care. I'm opposed to that. I voted 30 times to repeal it, and when I get to the Senate, I'll be the one that votes to make sure it gets repealed totally.
Dr. McCaskill, would you like your additional 45 seconds there?
Well, I think it's important to remember that there is a lot of misinformation about this bill. There's not a government plan in it. It's all private insurance, and there's good things in it. And you need to remember what Congressman Akin wants to repeal. He wants to repeal the ability of insurance companies to say you're out of luck because you've had the nerve to be sick before. He wants to repeal kids being able to stay on their policies until they're 26 years old. He wants to repeal a focus on free prevention so we can avoid serious health care costs down the line. He wants to repeal the insurance companies having some rules of the road and having to refund your premiums if they decide to spend most of their money on more people to deny your claims rather than on your health care. I think if Missourians will give this legislation a chance, they're going to be pleasantly surprised.
Okay, the next question comes from Nassim, and it goes first to Senator McCaskill.